No one ever told you that your joints have a secret power, did they? A power that, unlike your teeth, allows them to heal, to regenerate, to restore themselves. This one truth could completely transform how you think about aging and pain. Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. It is absolutely crucial that you stay with me until the very end of our discussion today. Because at the end, I will reveal the single greatest secret to treating joint pain, a profound insight from a traumatologist with 30 years of first-hand experience. It's a concept that turns conventional treatment on its head, and it has nothing to do with expensive pills or procedures, but everything to do with understanding the hidden forces at work within your own body. This is the piece of the puzzle you've been missing. Let's begin by asking a simple question. What do our teeth and our joints have in common? On the surface, it's that they can both cause significant pain and suffer from wear and tear over time. But there, the comparison ends. Unlike a tooth, which once damaged is damaged for good, your joints possess a remarkable, almost magical capacity for regeneration. This natural process of rebuilding bone and cartilage tissue is constantly happening in your body, a quiet response to inflammation, to minor injuries, and even to the natural effects of aging. So this begs the real question. If our bodies are designed to heal, why do some people seem to glide through life with effortless grace, while others are plagued by painful, stiff, and creaking joints that make every step a chore? The answer lies in understanding how to support this natural process, not hinder it. Today, we will uncover the secrets to true joint health. We will explore whether certain oils can genuinely alleviate that deep ache in your knees. We'll ask if the bone broth your grandmother swore by is merely a comforting myth, or if it truly holds the building blocks to restore cartilage. Can a simple root like ginger truly quell the fires of inflammation? And we will settle the age-old debate. When you're in pain, is it better to reach for a heat pack or an ice pack? Most importantly, we will discuss how to arm our children with the knowledge to protect their joints, setting them up for a lifetime of activity and freedom. First, we must understand why our joints tend to become more troublesome with age. Picture your joints as a perfectly engineered hinge, cushioned and lubricated by a slippery, shock-absorbing substance called synovial fluid. In our youth, this fluid is plentiful and thin, allowing for smooth, frictionless movement. But as we age, two things happen. The protective cartilage that caps the ends of our bones begins to thin, and the synovial fluid itself can thicken and decrease in volume. This creates more friction, leading to pain and reduced mobility. Here is a critical point that is so often misunderstood. Your cartilage has no nerve endings. You cannot feel it wearing down. The pain you experience comes from the underlying bone, which is incredibly rich with sensory nerves and receptors. When that protective cartilage cushion thins, the bones are exposed to pressure and friction they were never meant to endure. This irritation triggers inflammation, which in turn irritates those sensitive nerve endings, sending pain signals screaming to your brain. This leads us to the many faces of joint pain. It can stem from various factors, from simple vitamin deficiencies to more complex conditions like gout. For most people, however, the discomfort arises from this slow, degenerative process of wear and tear. Learning to interpret your body's signals is key. If you feel a dull, throbbing ache even when you're sitting perfectly still, that's a clear sign of active inflammation. Conversely, if the pain primarily strikes when you begin to move, climbing stairs, opening a jar, getting out of a chair, that points more towards mechanical wear, the hallmark of arthritis. And what about that frustrating morning stiffness, that feeling of being locked in place? That is classic inflammation that tends to fade as you get moving and encourage that synovial fluid to circulate once more. When faced with this pain, many people reach for powerful painkillers to find immediate blessed relief. And while these can provide a temporary ceasefire, they are only muffling the alarm bell. They are not putting out the fire. A far more effective and permanent approach is to address the root causes. This involves a three-pronged strategy: physically liberating the compressed joints, incorporating specific anti-inflammatory exercises into your routine, and nourishing your body with powerful anti-inflammatory foods. In essence, we must stop just silencing the pain and start solving the problem. Let's talk about practical, immediate steps you can take. Problems in the joints are often aggravated by the simple physics of aging, injury, and excess body weight. For every single pound of excess weight you carry, you are placing 4 pounds of extra pressure on your knee joints. Imagine strapping a sack of potatoes to your back and carrying it all day. Losing even a modest 10 pounds can feel like taking a 40-pound load off your knees. It's a powerful change. If your hands ache, be mindful of lifting heavy objects. If your hips or knees are the source of your pain, avoid sudden jarring movements and invest in good, well-cushioned shoes that absorb impact. Consider taking up swimming. It is a true gift to aching joints. The natural buoyancy of the water supports your body weight, taking all the pressure off your skeletal frame while still allowing you to move through a full range of motion. This not only strengthens the muscles that support your joints, but also promotes the circulation of that essential synovial fluid. Herein lies a profound paradox. When our joints hurt, our instinct is to stop moving. But inactivity is often the worst thing we can do. It starves the joint of vital fluid and allows the surrounding muscles to weaken, creating even more instability. Movement is life. It's also important to distinguish between the two most common joint conditions, osteoarthritis and rheumatoid arthritis. Osteoarthritis is a mechanical issue. It's the result of that cartilage deteriorating over time, leading to pain after activity. Rheumatoid arthritis, on the other hand, is an autoimmune disease characterized by chronic inflammation of the joints, where the body's own immune system is attacking the joint lining. These two conditions, while both causing pain, require fundamentally different treatment approaches. Your body sends whispering warnings long before it begins to shout in pain. Let's learn to listen. If your joints feel stiff and immobile when you first wake up, but the feeling improves as you start your day, that can be an early sign of changes in your connective tissues. If you feel a distinct burning sensation, especially if the joint also appears red and warm to the touch, this is a classic signal of inflammation. A burning feeling without redness or heat is more often associated with the friction of osteoarthritis. Pay attention to a limited range of motion. Do you find it difficult to fully bend your knee, to hold a key, or to lift your leg onto a high step? These are not just signs of aging, they are signs of a problem. And what about those creaks, cracks, and pops? Sometimes this is perfectly normal. It can be caused by pressure changes within the joint, forcing tiny gas bubbles in the synovial fluid to burst. If there's no pain and your movement isn't restricted, it's usually nothing to worry about. However, if those noises are accompanied by pain or a grinding sensation, it could mean that the articular fluid is low, causing the surfaces of your joints to rub against each other, which accelerates the wear and tear on your cartilage. Have you ever felt your joints ache just before it rains? You aren't imagining it. While the exact scientific mechanism is still debated, this phenomenon, known as climate sensitivity, is very real. It's thought that changes in barometric pressure can affect the pressure within our joints. In the winter, the body cleverly reduces blood circulation to the extremities, our hands and feet, to conserve heat for our vital organs. This can lead to stiffness and discomfort in those areas. The cold can also cause the synovial fluid to become more viscous and thick, like cold oil, making movement more difficult. The simplest solution? Keep your joints warm. Now, let's build our body's internal repair kit. The right foods can nourish, protect, and even help restore our joints. Fatty fish like salmon, sardines, and mackerel are rich in omega-3 fatty acids. Think of omega-3s as the ultimate internal lubricant and anti-inflammatory agent. They help preserve the flexibility and health of your cartilage. But they're not the only source. Walnuts, flaxseed, and almonds are also wonderful providers of these essential fats. Combine these with antioxidant-rich foods like blueberries, pomegranates, and red bell peppers, which help combat the cellular damage caused by inflammation. Protein is non-negotiable. It provides the literal building blocks for all tissue repair in your body. Ensure you're consuming quality protein from meat, fish, eggs, or plant-based sources like beans and peas. And we must not neglect collagen. Collagen is the primary structural protein in your body, the very scaffolding of your cartilage and tendons. It's what gives them their strength and shock-absorbing properties. As we age, our natural collagen production declines, leading to less flexible joints. Consuming collagen-rich foods like bone broths, gelatin, and certain cuts of meat can provide your body with the raw materials it needs to fortify these tissues. Simple spices like turmeric and ginger are also powerhouse anti-inflammatories that can make a remarkable difference when consumed regularly. While cartilage regeneration slows with age, it never stops completely. One of the simplest and most affordable remedies to support this process is gelatin. Gelatin is essentially cooked collagen, a protein that directly contributes to strengthening cartilage and connective tissue. Here is a simple daily ritual. In the evening, mix 2 teaspoons of plain gelatin powder into about 1/3 of a glass of cold, filtered water, and let it sit overnight. In the morning, top it up with warm water to fill the glass, stir, and drink it on an empty stomach. Practice this daily for a week, then take a month off. This method delivers a direct dose of collagen to your system, providing a much more economical alternative to expensive supplements. There are also wonderful traditional remedies that can provide comfort. A simple compress of aloe vera juice and honey can soothe pain and inflammation. Mix 1/4 cup of each with 1/4 cup of warm water. Apply the mixture to the painful area, cover it with plastic wrap, and leave it on overnight. Another potent remedy involves chili peppers. Red peppers contain capsaicin, a compound that creates a warming effect and acts as a natural analgesic. It works by depleting a pain-transmitting chemical in your nerve endings while also stimulating blood flow to promote healing. You can make your own infused oil by steeping 10 washed red peppers in a jar of vegetable oil for a week in a warm place. Gently massage this oil into your sore joints during a flare-up. Now, as I promised, we arrive at the most crucial piece of insight. An orthopedic specialist with over 30 years of experience shared with me a concept that changes everything. He explained that osteoarthritis occurs when that smooth cartilage breaks down, becoming dry and brittle, leading to bone damage. But he insisted that the joint itself is often not the primary villain. The true problem, he said, is that the joint becomes a prisoner, trapped in what he called a muscle cage. Think about it. Through years of poor posture, repetitive motions, or old injuries, the muscles surrounding a joint develop tight, painful knots known as trigger points. These chronically tight muscles constrict and compress the joint space, pulling the bones out of their natural alignment and creating constant, unnatural stress. He gave a perfect example. Your knee might be screaming in pain, but the true culprit could be a deep, tight muscle in your buttock. That locked-up muscle pulls on the connective tissue that runs down your leg, creating immense strain on the knee. No amount of rubbing your knee will fix a problem that originates in your hip. The pain is merely a referred signal from the real source of the trouble. So the great secret is this: we must release the cage. The most effective long-term treatment is not to bombard the joint with medication, but to release these muscular trigger points through targeted stretching, deep tissue massage, and physical therapy. When you release the muscles, you free the joint, you alleviate the pressure, restore normal mechanics, and allow the body's natural healing processes to take over. This is why it is entirely possible to be 62 and feel more flexible and pain-free than you did at 30. The true problem is not age, it is the accumulation of these muscular blockades. Balance your activity with rest, maintain a healthy diet, stay hydrated, and focus on releasing the tension that imprisons your joints. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.